You can always just click through. It's just weird. Making speed it up. With that, I'll turn things over.
Thanks for invitations. So yeah, there are a lot of I saw okay. So I saw like great presentation that I really want to be a part of that, and I hope you also feel the same way when I present our studies. So today the study I want to present is about how we can better help clinicians to address social determinants of health. And so I want to start with the concept of social determinant of health. So this concept means things like cultural, economics, and social factors that may influence people's health. But that will also lead to individual and group differences in health status, which means social determinant of health would be a good predictor for health inequality. So as you can see here, social determinant of health may include some socioeconomic factors such as education, job status, family support, and family social support incomes. And they might also involve in some physical environments, related factors, and health behavior. And for healthcare, it only accounts for 20% of people's health. So that means other factors are very important, but we still try to figure out what's the best way to address that. So the problem space of this work is how to address social determinant of health in the clinical settings. And when we talk to clinicians, we also found that they feel like they try to address the social determinant of health. They knew that they're aware of the importance of this topic. They also try to have some actions to rule these issues. But the main problem is that they couldn't find an efficient way to approach to respond to patients' needs, even though they really want to. So we conduct some interviews, and the result shows that there are at least 3 areas we could improve. The first thing is the EHR assistance. So it's kind of fun, interesting to see the EHR assistants that they actually have a space for clinicians to document social determinants such as like tobacco use, transportation issues, or something like that. But all they can do is just check the box, and then that's it. There's nothing else. So that leads to the next problem space that we can improve. That's the community resources. So a lot of times they try to help their patients, but they just don't know what kind of resources they have in the community. So that means we need a better way to figure out what's the assets in the communities and what's the available resources in the community. So that means they also need a certain level of community engagement. And last but not least, that's patient education. So for when they try to document or try to ask patients' needs, and it's also interesting that there's no research focused on introducing the concept of social determinant of health to the patients. I know there are some research focusing on improving health literacies among patients, but there's no, I couldn't find a single research focusing on introducing social determinant, this concept, to the patients. So to me, it's kind of interesting because you want to document their social needs, but they are not taught how to report their needs to anyone else. So there's a lot of room to improve in terms of patients' education as well. So for our next few steps, we try to improve the EHR systems through the co-design process with connections, and we also try to create a list or try to figure out how to allocate the community resources, and also maybe add a role in the clinics that add a role that find someone who can identify the resources for them, like social workers or similar roles. And we also need to increase the awareness of and knowledge of social determinants among patients, not just for the clinicians. So that's some next few steps. Yeah, and if you guys are interested in any part of this project, please feel free to reach out to me or Ravi. So we have been working on this topic for at least like 8 months or almost a year or something. Yeah. All right. Any questions, comments?
So is part of what you're doing trying to figure out where you get the data?
Mhm.
So like you have